Spine surgery versus natural healing, what you need to know. Namaste, I am Dr. Vardhan, your host and dost, India's #1 Ayurveda spine specialist. Today, we are tackling one of the most common and most misunderstood questions in spine care. Do I need spine surgery or can I heal naturally? It's a question thousands face every day. One MRI, one consultation, and suddenly you are told surgery is your only option. But here is the truth. In many cases, it isn't. This episode is your deep dive into the facts behind spine surgery, natural healing, and how to make the right decision for your health and your future. Let's get into it. The moment you are told you have a slip disc or nerve compression, fear kicks in. Pain in the leg, can't sit, MRI shows disc bulge. You go to the doctor, they see the scan, and what do they say? You need spinal surgery. But here's what you have not told. Most disc issues don't require surgery. Most back pain isn't a surgical condition at all. And most people can recover fully without going under the knife. The pressure to operate is real because surgery feels like a solution. It sounds quick, it feels like control, but that control can come at a cost if it's rushed or unnecessary. I'm not saying that surgery is bad. My point is that the decision to have surgery should come with education, options, and time. Pain is not always a medical emergency, and healing doesn't always mean cutting. Let's break down what spine surgery actually is. When you go in for a discectomy, the surgeon is removing a portion of your disc that's pressing on a nerve. In a laminectomy, bone is removed to relieve pressure on the spinal cord. In spinal fusion, two or more vertebrae are locked together with screws and rods. The goal in all of these, relieve nerve pressure, stabilize the spine, and reduce pain. And yes, in some cases, that's exactly what's needed. But here's the part most patients don't hear. Success rates vary. There can be scarring, mobility might reduce, pain might return, sometimes in a different form. There's always the risk of adjacent segment disease where the joints above and below fuse and wear down fast. No surgery is free of risk, especially on the spine. If your symptoms are severe, surgery might be worth those risks. But if your symptoms are manageable or if they are improving slowly, rushing into surgery might do more harm than good. Well, you have started considering me as anti-surgery. But let me be very clear, I am anti-unnecessary surgery. If your spine is shutting down, go to the OT. But if it's inflamed and irritated, try to heal it. In Ayurveda, we are not just fixing the back pain. We are restoring the body's internal harmony, where pain doesn't keep coming back. In other words, Ayurveda approaches back issues from the root. Most spinal problems are caused by aggravated vata dosha, dryness, instability, and poor nerve flow. Ayurveda calms vata, nourishes the discs, and then reduces inflammation. In Ayurveda, for back pain, we use a variety of therapies. For example, oil-based therapies like Abhyanga, localized therapies like Kativasti, detox protocols like Panchakarma, and personalized herbal support. In Vardhan Ayurveda, our experts also hinge on other treatments to treat back pain. These include movement therapy, core activation therapy, posture corrections, and spinal decompression are all part of the process. It is true that natural healing takes time. It takes effort, but it respects your spine's ability to regenerate if given the right tools. However, there are some clear red flags that mean surgery may be necessary. For example, if you are experiencing sudden loss of bladder or bowel control, foot drop or paralysis, severe spinal instability, no improvement after 1 year of proper conservative care, then yes, surgery might be life-saving. But these cases are the minority. The majority, they have pain, maybe nerve irritation, maybe a disc bulge, but they still have full function. And in those cases, the first option should always be non-surgical. We are living in an age where surgery is offered faster than options. But you now have the knowledge to pass, to ask the right questions, and to explore every pathway before the operation theater. Surgery has its place, but so does natural healing. The key is timing, the key is understanding, and the key is you. That's it for today. If this episode gave you clarity, share it with someone who is facing the same dilemma between surgery and non-surgery. Subscribe to the channel for more honest insights into spine health and Ayurveda, and hit that bell icon to stay notified. Stay safe, stay strong, and take care of your spine.